Welcome to our demonstration of the BioScanMSA Ivory. Why choose the BioScanMSA Ivory? The BioScanMSA Ivory incorporates an ohm meter, which measures galvanic skin response with our world-class Ivory software for quick and non-invasive testing. It's the only EAV software on the market designed specifically for the dental field. Easy to chart the patient's teeth with a current Panorex X-ray, and test patients for compatibility with dental materials. Our comprehensive scan of each tooth is performed to determine if it's balanced. The out-of-balance teeth are further scanned to determine if the tooth is the problem or if it's a systemic issue. With advanced training, you have the ability to use it in dental surgery, and it provides full, colorful, easy-to-read reports, which provides valuable information for the dentist. What are the practitioner requirements to make this investment? The BioScanMSA is an FDA Class II cleared medical device in the USA. All practitioners using the device must have a health field credential or be working under the supervision of a dentist. It's the role of the practitioner to ensure their designation allows them to use the BioScan in their country, state, or province and locations. Proof of certification must be emailed before purchase can occur. Now, what are the parts of the BioScanMSA Ivory? You can see here is the BioScan box. We have our different styluses. This is the Epic stylus and the manual stylus, and the hand mask that the patient will be holding while you're doing the testing. This device here is the focus. This is what sends the frequencies of what you're testing into your patient. And the test plate allows you to put items into the circuit to test directly. Dental compatibility testing is one of the features of our Ivory software. When you have multiple choices of dental materials to use on a patient, how do you know which is best? The BioScan system allows you to test your patients for compatibility with the dental materials used in your office to ensure best results. Choosing compatible materials can help decrease the likeliness of future complications. We know that all dentists have different materials that they use in their office. Our software allows you to create a custom library to test your dental materials. When we have our software open and we've found a balance point to do our compatibility testing, we're going to go to our custom library, which you will have created. You have two ways of deciding how you want to populate your dental materials in the custom library. You can see this first custom library we have, Dr. B dental materials. We've just put them in, so they're alphabetically in there, not organized in any categories. If we go to the other library that we've created, Dr. D dental materials, we have them in folders. So if you're going to be doing surgery, you want to look at the anesthetics that you might use, you can do compatibility testing with that. So you click on there, and then the items that you could use will populate. As you're doing your testing, you're going to come to the desired list. You're going to come to the item you want to do the testing, and then you're going to begin. The MSA Ivory Dental Material Compatibility Report looks something like this. You'll see the items that we've tested are on the left-hand side, and the outcomes are color-coded and sorted on the right-hand side. Anything that green means it resonated and was compatible with the patient. The red readings are a stressed outcome, and the yellow readings are an inflammatory response. So when you're looking at which materials to use with your patient, the ones that are green are the best choices. As mentioned before, the BioScanMSA Ivory can be used in dental surgery. It can be challenging to know when all the work is done when doing dental surgery. Sometimes something is hidden that is still unresolved that can't be seen by the naked eye. Using the BioScan system during surgery allows you to test the area initially to see the unbalanced meridian and to continue testing to know when the meridian is unblocked. Electricity can't go through dead tissue, so once it's unblocked, the issue is resolved. Part of our advanced training is determining the burden of the tooth. A comprehensive scan of each tooth is performed by the technician to determine if the tooth is balanced. The out-of-balance teeth are further scanned to determine meridian relationships to the tooth pain. When meridians of the teeth are affected, the patient may experience symptoms such as pain, illness, or chronic disease. The BioScanMSA Ivory data provides your dentist with feedback to be used to create a customized protocol to help improve the health of the patient. Here we can see a picture of a technician taking a reading on a patient and testing the teeth. When you're ready to check the burden on the teeth, this is what the screen will look like. We have a screen for adult teeth and a second one for primary dental teeth. You'll start by coming and charting the tooth. So you can either right-click to choose the item, or you can multi-select if you have a number of teeth with the same thing you need to chart. Once that's done, you're going to come and start taking the readings. We make sure we're on the right tooth and we come and take the reading. That one is balanced. It's moved on to the next one. That one is also balanced, and we continue through until we have done all of the teeth. If we find that one is out of balance, then we're going to go to our library and find out if it's the tooth or the dental lens that is the issue. Once you have completed all of the testing, you will get the dental meridian report. At the top here, you can see the different teeth. You can see the base readings and then the readings when we balance the teeth. You can also see the issues that we had or what we charted when we were looking at the Panorex X-ray. Along the bottom, we have the different teeth. We have their status based on how we charted them. And then we have the condition or the notes related to what balanced that tooth. Looking at a close-up of the upper section of the report, we can see many of the teeth were balanced, and there were a few that were unbalanced with stressed readings. We were able to bring them into balance. We can see a 50 is a perfectly balanced reading. And if we take a close-up of the next part, so the first tooth we have here, it was charted as extracted, and we can see what helped to balance it. What this information will provide the dentist is whether the tooth is an issue itself or whether it's the dental end of the meridian that is causing the issue. Why choose BioScanMSA Ivory? We have the automated Epic and the AcuPoint 2 with SureTouch tip. These stylus allow for precise measurement of the points. Custom library for the Ivory software, including dental nosodes and dental end folders, and an extensive dental materials list. We have 3 levels of training available. The first is dental compatibility, an introduction to EAV testing. The second level is using the BioScan in dental surgery. And our third level is determining the burden of the tooth with the BioScan. Most of our training is now provided via webinar for your convenience. We have annual software updates, and we have a warranty on the BioScan system. We offer 24-hour customer support and have full-time mechanical and software engineers on staff. BioScanMSA Ivory upgrade. For our existing BioScanMSA practitioners who would like to do dental testing for a dental office, The Ivory upgrade can be added onto your current MSA application. The requirements for the Ivory upgrade is Level 2 MSA training with a minimum of 1 year of actively using those advanced features. If you have any questions or you would like more information, if you already have an account executive, please reach out to them, or you can contact IHT with our website, www.ihtbio.com/learn.